Hello and welcome to Your Health Matters with Tinu Odunuga. Today I am in the studio with two of our eloquent guests, our doctors. Our doctors will be talking about diabetes and hypertension. What type of diabetes are there?
So we have type 1 diabetes and we also have type 2 diabetes. So type 1 diabetes is when the person's in pancreas, which is the organ of the body that produces insulin, stops working, so you have low insulin, and then you need to have insulin injections. That's why those kind of diabetics have to have insulin injections. Type 2 diabetics is when you have the insulin, but because your own body is not reacting to your insulin, so your insulin is not working on your own body, and then you have to take medications that can help your body to accept your own insulin.
And like Dr. Sarah said, so usually with the type 1 diabetes, they're not making this hormone at all. They're not making any insulin at all. And so therefore, when they eat, you have this load of sugar in your bloodstream, but the body is not using it. And that's why they have the symptoms that they might have. And the type 2 diabetes, they're making some level of insulin, but they're not making enough of it to use when we eat. So you still have a high level of sugar in the blood.
So type 1 is severe. If you do not take your medication, it can lead to death.
It can actually lead to death quite quickly, and it's really very, very severe. Type 2 diabetes, it can cause death, but it is a slower process, because in that case, because the person or the patient they actually have insulin, but it's not being used properly. So they do have signs and symptoms, but it just causes general organ damage bit by bit. So and it usually happens when the person is older. So that's the difference between the two.
What are the symptoms or signs?
The symptoms of type 1 diabetes, the classic symptoms which we are taught in medical school are when the person is very, very thirsty, drinking a lot of water, and still despite drinking water fluids, they still feel thirsty, going to pass a lot of water out, and feeling very, very hungry, and also losing weight. I had a patient like that about 4 weeks ago, and she was just, even when she was in the surgery, she ran out to quickly buy a bottle of malt, and when we checked her blood sugar, it was sky high, and I had to.
And she didn't know.
She did not know. She did not know. She later came back to thank me with a box of perfume for saving her life.